Two nurses at Waikato Hospital have tested positive for COVID-19. The senior doctor there now wants the government to make it compulsory for hospital staff to wear masks. And he thinks we all should too. The doctor spoke exclusively to our investigations reporter Michael Morrow, who is with us now. Michael.
Yes, well, this is Shin Yang Liao, the head of the Older Persons and Rehabilitation Ward at Waikato Hospital. He says his elderly patients are now at risk and action is required urgently to avoid unnecessary deaths. He says 4 medical teams have been sent home since the nurses returned the positive result. He wants all hospital staff, regardless of who they have interacted with, to wear masks to stop spreading the virus. And he's worried about access to protective equipment. The Director General of Health says hospitals have plenty of PPE, but Dr. Lau says that is not the case. He's the clinical director on the ward caring for the Waikato's most vulnerable in this crisis and has a message for the Prime Minister.
Prime Minister and the Ministry of Health and all Kiwis, if you cannot keep social distance, please wear a mask. Any mask is good than no mask.
2 of his colleagues, both nurses, are confirmed to have COVID-19.
The whole ward has been closing down, and the 4 medical teams affected, and the many doctors and nurses are sent home.
This is some of his nursing team. He says he's proud of all of his colleagues, but current government rules mean staff are only required to wear masks and other PPE if they are interacting with possible COVID-19 patients.
All the non-COVID patients, and nobody wear masks. And I'm really concerned our old patients may get infected and they may die.
He believes the number of cases at the hospital will increase and at least 1 patient is already being tested as a possible case.
The number will grow and there will be other staff members get affected and there will be patients get affected.
The Health Ministry says it has increased stocks of PPE, but this does not mean all health workers should wear a mask with every patient. Official rules state we can't afford to waste or misuse a valuable resource.
The guidance is good. It's based on the advice of specialists, and likewise it's consistent with the advice from the WHO.
But in the US, the Centre for Disease Control is urging everyone to wear masks. It says significant numbers of people with coronavirus can be asymptomatic. Its advice is clear. Everyone should wear a mask. That's the public too, especially in areas where social distancing may be difficult, like supermarkets.
If you cannot get masks, make your own. Any mask is useful.
The Health Ministry's been under pressure over its PPE distribution. Today, the Director General reiterated what he said before.
Every DHB, including hospitals, has plenty of PPE.
I don't think there's enough masks, despite Dr. Broomfield said we have sufficient supply. We don't.
He says emergency department staff are being told not to change or rip single-use gowns. We asked the Waikato DHB about this 5 hours ago. They have not responded.
Planning to recycle them, which isn't a bad idea. We don't have enough.
Dr. Lau, a hard-working senior physician who's speaking out on behalf of his colleagues, the public and patients, and his message is unequivocal. Demand masks, wear one and stay safe.